And the latest, the World Health Organization speaking earlier on in its regular press briefing, saying that at this point it's very difficult to tell what the trajectory of COVID-19 is worldwide 7 months on, saying that what is important is that there must be better COVID-19 diagnostic and therapeutics efforts, also saying that unrecognized cases are still continuing, saying that they're unrecognized by surveillance and testing, speaking specifically about Africa here, but saying that a vaccine expansion is something that they're looking at. This is New Zealand officials are investigating the possibility that its first COVID-19 cases in more than 3 months were imported by freight as the country's biggest city plunged back into lockdown on Wednesday. The discovery of 4 infected family members in Auckland led the Prime Minister, Jacinda Ardern, to swiftly reimpose tight restrictions in the city and social distancing measures across the entire country. The World Health Organization website states that there is currently no confirmed case of COVID-19 transmitted through food or food packaging. However, it also knows that studies have shown that the virus can survive for up to 72 hours on plastic. For more, we're joined now by vaccinologist Professor Shabir Madhi. A very good evening to you, Professor Madhi, and thank you so much for speaking to us. I'd like to start with this case in New Zealand. The World Health Organization, that there need not be panic in terms of food and its process and the spreading of COVID-19. But if it's possible that COVID-19 has been spread via freight, is that something that should alarm not only New Zealand but other countries as well?
So good evening to you. So I think it's extremely unlikely that that is the reason why there are these new cases in New Zealand. The virus can survive on surfaces, as you mentioned, for up to 3 days, and especially in cooler temperatures. But the reality is that for a person to get infected through that mode of acquisition is highly unlikely. I think over the past few months, what we've come to appreciate is that the dominant mode of spread and transmission of this virus is directly between people and possibly airborne transmission, which is when you're in a poorly ventilated area, and if there's small particles that are hanging around in the air, one might actually inadvertently breathe in those small particles. But in terms of coming into contact with contaminated surfaces, as a mode of acquisition of the virus, that's extremely unlikely. So I don't think there's much reason to be concerned. And
I want to just juxtapose what happened in New Zealand and in China. So in New Zealand, it is said that the father worked at a shipping company where they were dealing with frozen foods. In China as well, they reported several instances of the coronavirus being detected on the packaging of imported frozen seafood in recent weeks. What does this mean for refrigerated conditions first in terms of the virus and how it behaves?
Right, so I think we need to be careful in that when we're talking of detection of the virus, you can be detecting sort of the genetic material of the virus, and that is usually the test that's been done, or you can actually try to culture the live virus. And when we're talking of detection right now, you're referring to identifying that virus using sort of identifying genetic material rather than live virus. So we know that this virus does spread in the environment. It can contaminate the surfaces, but often if you were to actually look for it on that surfaces, you'd be looking for genetic material which will be positive, but it doesn't imply that it's live virus. So we just need to be careful in terms of sort of not confusing the presence of genetic material of the virus to the presence of actual live virus, which is what is required for the virus to infect someone. So
then what is the likely explanation in these two cases? And I want to talk about food packaging as well. You say there needs to be a clear distinction about the detection of the virus and the genetic material of the virus. So if we're talking about it surviving on surfaces, especially on plastic, for instance, what terminology are we using? What is the likelihood of what we are finding here?
So the virus can survive on surfaces, including plastic, including on glass surfaces, an example, for up to 3 days. But under very sort of restrictive conditions, in that it needs to have the correct temperature, the right type of humidity. So again, I think our experience in terms of how this virus has spread in South Africa as well as globally indicates that that sort of acquisition of the virus is extremely unlikely.
Okay, and China is also now speaking about running tests on chicken wings from Brazil. In that case, would it, obviously we've spoken about animal to human transmission, is that the most likely way, or is it, the WHO was actually saying in its press briefing earlier on about how heat can destroy the presence of the virus. So how is this possible?
Correct. If you're going to cook your food, you're not going to get infected, not only by the SARS coronavirus, but many other bacteria and viruses that's probably present on that sort of food. And that's the reason why we encourage people to cook their food properly. So, like I said, it goes back to the whole issue in terms of what explains the way this virus is actually spread globally, and as well as how it spreads within countries. And again, it really comes down to the issue that the dominant modality of transmission of this virus is directly between people and through airborne transmission, and not through contact with contaminated surfaces, and extremely, extremely unlikely because of ingestion of food or contact with food materials as being the source of acquisition.
What would you then say to South Africans watching this, or anybody who's watching SABC News Channel from wherever they are, on the food chain handling, or what to do best? Apart from cooking your food, what other safety measures, precautionary measures can we take? Are there any particular foods that we would be wary of if we're trying to avoid, contracting COVID-19?
Yeah, as a short answer to that is no. I think we need to understand what New Zealand is doing. They're really being thorough in terms of looking at different possibilities in terms of how the virus actually came back in New Zealand. And we also need to remember that there was a certain amount of human traffic between New Zealand and Australia, which is the more likely reason why the virus ended up going back in New Zealand. In terms of food safety, I think we can't lose focus in terms of what really needs to be done. And what really needs to be done is sort of avoiding overcrowded situations, wearing the face mask, ensuring adequate ventilation. People are not going to get infected by any meaningful measure because of contact with food. So I think we just need to get focused, or else we risk creating more anxiety, more stress in terms of what to do and what not to do. And this is not the reason why the virus necessarily got back into New Zealand.
So let's talk about that. The WHO at its press briefing earlier on was speaking about unrecognized cases, especially on the African continent, unrecognized through surveillance and testing. What do we mean here? What are we talking about?
So that's a much more important issue. And the reality is what we face in South Africa, and more so in the rest of Africa, is that our ability to test at scale is very limited. And South Africa does probably more testing than the rest of Africa. It does about 60 for every 1,000 of the population. But even that is about 1/3 of the amount of testing that's done in the United States. What it basically tells us is that even in South Africa, we probably have underestimated the number of cases that have been infected with the virus, anything between 7 to 10-fold. In other countries, such as Nigeria, as an example, where their testing rate is about 1/40th of what it is in South Africa, they probably underestimating the true number of cases at least 40-fold compared to South Africa. So the numbers that we hear for Africa really represents the tip of the iceberg because of our limited ability to test at scale. And unfortunately, that requires a huge amount of investment and resources, and that is not going to change overnight. To develop laboratory capacity on the African continent doesn't happen overnight. It takes a huge investment, and it needs to be sustained.
The WHO briefing also acknowledged the fact that in the past 7 months of the globe dealing with COVID-19, the trajectory has not been obviously what was predicted. It changes. It's a unique from country to country experience and handling thereof. But they did call for a better and faster need for diagnostic and therapeutics. What are we getting right? What should we be working on in South Africa?
Right, so I think in South Africa, we're certainly one of those countries where the sort of models that were developed in terms of predicting what was going to happen hasn't necessarily turned out. And in fact, we're probably better off than what many of the models indicated as being the most optimistic scenario. In that the number of people that have died, and possibly the number of infections and the number of deaths that were required in hospital, has actually not materialized. And there's a number of reasons why that might have occurred. But what you mentioned is completely correct. This virus is behaving very differently in different settings. And in part, it's related to the differences between settings. It's an example in terms of population density, in terms of people's behavior. And then there might be other issues at play as well. So South Africa, as an example, certainly is a beneficiary in terms of the experience that was gained in other countries before COVID started to surge in South Africa. As an example, the use of dexamethasone in a treatment of individuals with severe illness, or remdesivir, which is an antiviral agent. We were beneficiaries in terms of the knowledge that was generated elsewhere, and we could more rapidly implement it when caring for severe cases in South Africa. So we've had some sort of advantage over other countries where the surge occurred at an earlier stage.
Thank you so much for speaking to us and sharing your insights with us. Vaccinologist Professor Shabir Madhi, thank you once again. And